Hi everyone, I am Allie Elder, a physical therapist at Reactive Physical Therapy, and I am really excited to share some really awesome information about this Women and Parkinson's Disease um, research and care initiative that was put together by the National Parkinson's Foundation. So I'm really excited to share some information, so hopefully I'll have some people join us, maybe make some comments in here and kind of get engaged. Otherwise, it'll be posted as you guys will see. So the topic is about closing the gender gap in research and care for women with Parkinson's disease. And I was so lucky and blessed to be a part of this process as a regional team member. And so I'm just going to kind of lay out what we did and what the National Parkinson's Disease Foundation put together and was actually funded by a grant from PCORI, which is a patient-centered outcomes research institute. But basically, the National Parkinson's Foundation got this awesome grant. And starting in 2017, in January, they started building these ideas. And over the course of 2 years, or a little bit more, they organized over 10 regional forums across the nation to gather information about the unmet needs and disparities that happen between men and women who have Parkinson's disease. So it was really great. Myself and Sharon Krishner, who is the leader of the Twitchy Women Support Group, so shout out to her, and Dr. Adrienne Keener, who is a movement disorder specialist at UCLA. We organized the one in Los Angeles, and it was so great to hear what people had to say, share their experiences. And really, we talked about looking at care and research, treatment and risk, and kind of prevention of how those things play into specifically the needs of women. So it was a really great experience. And that happened in 10 different regional areas across the nation. And then ultimately, what happened is that all of the regional team members, we all traveled to Houston, where everyone kind of got together and we talked about it at a national team meeting. So after all of that, the National Parkinson's Foundation put together this agenda. And they put together this 50-page agenda, excuse me, that is actually linked to at the top of this post, where you can go download the PDF totally free. So I really encourage you all to do that. And it has some great information, some really cool pictures, and some quotes that are really quite meaningful. So I really encourage you guys to all look at that. And I'm just going to talk about some of the highlights that I think were important that I'd love to share with you guys. And hopefully someone could post in the comments if there's anything that you want to discuss further or any of that. So basically, the ideas and themes that were coming up consistently over this had to do with the components of a biological and hormonal standpoint. While the research is pretty unclear, there are some studies that suggest that estrogen is actually neuroprotective for Parkinson's disease. They also think that there might be an interaction between levodopa and estrogen, which may be why women tend to develop more dyskinesias or have more wearing off periods. But all of this stuff hasn't been researched to really validate or say one way or the other. And part of it was discovering from the people as well as healthcare practitioners that participated in these forums to figure out what were the unmet needs, what do we need to know more, and where can we put funding into research, where can we put more funding into grants for the community to support. And I don't think I mentioned this, but in these forums, they were half women with Parkinson's and half of the people attending the forums were actually healthcare providers or stakeholders in some sort of field like social work, PT, OT, neurologists, as well as care partners for women with Parkinson's. So there was a wide variety of young onset, late onset, different socioeconomical backgrounds, all of the above. So it was really cool and built and set up that way to be really diverse. But when it comes down to it, what we realize is women are not tiny men. And so when we take into account the hormones that play into this, we really have to take that into account when there's dosing for medication, when there's symptom onset, when there's things where you're trying to manage your symptoms or diagnose it, maybe the symptoms are different, and we know that they are. And so I really would encourage you to look at the agenda and kind of get more of the data on there on how those symptoms are pretty clearly different in their presentation with women and men, and how it may have led to some unmade diagnoses because it wasn't as specific or clean as it may look with someone that has been studied more. So that kind of brings us to the second point, that many of the research studies, actually most, are all performed on men. And so it really makes it difficult to understand when the pharmaceutical studies, in terms of dosing and timing, are studied on men when it doesn't take into account this estrogen involvement as well as all sorts of other things that would be different. The size of women is different, and so it's not as simple as just dosing it as a tiny man. And so further research really needs to be looked at in this and put together. So hopefully by identifying these things in the agenda, it'll really put forth some effort to change the way some of these studies are done. Also, from a social relatedness standpoint, I think this was really interesting to hear from people, oftentimes women with Parkinson's disease, that this idea of inclusiveness, relevance, and that they want a high quality of care when it comes to having healthcare practitioners communicating with each other, which I know is so important. We really try our best to do that, and we really see the benefits of it when we work with the neurologists or other speech therapists that are, directly treating the patients that we see. So in terms of this social relatedness standpoint, it also is interesting that women with Parkinson's disease, it's obviously not as prevalent. So men typically have like a 1.5 to 2.1 times more risk of having Parkinson's. So prevalence, there are more men that are diagnosed with Parkinson's. However, women live longer. And so because women live longer, they're actually speculating that there are more, if not the same amount of women living with Parkinson's disease because of the length of the duration of their life. So it's really important to take that into consideration when people might say, oh, there's 2 times as many men that have it. Well, that might be just that there are 2 times that were diagnosed, but there's probably the same amount of women and men that are living with Parkinson's. So this is a big thing to take into consideration. Also, for women who function in a caretaking role or primarily take care of household duties in their home, it can be really difficult to retire from these duties. While in contrast, it might be a little bit easier to retire from a job if someone had a 9-to-5 job. So taking into account that the roles that women with Parkinson's may have had to fulfill prior to diagnosis and how that changes or needs to be adjusted when after diagnosis, it can be very difficult because you don't quote unquote retire from a lot of those positions, and support is needed to make sure that things are not too much of a burden. And so hopefully there will be more support in this area. This agenda really worked towards empowering women and getting more strategies for self-management and advocating for themselves. And it's really a great way to kind of summarize all the things that that was talked about from all the people around there. So I'm just really excited to share this agenda and hopefully give you a little bit of a brief overview. And as always, I'd love to hear what your thoughts are. But overall, I won't go into all of the details, but take a look and let us know what you think. And if there's anything that would be kind of desire to put into place, we want to hear it. So if you guys have any questions, let us know. And thanks again for listening. And we'd always love for you if you could subscribe to our newsletter at www.reactivept.com. And when you sign up, you'll automatically get sent these great resources and all sorts of variety of things. So thank you guys so much. Thanks for tuning in, and we'll see you soon. If you enjoyed it, make sure you share it with your friends.